Hi, welcome to Open Mic Uncensored. I'm your host, Munchie Gerber, and today's episode, I'll be speaking with Maria McNamara, who is a representative for Impact Health Systems. I hope you enjoyed the show, and once again, thank you so much for watching.
Hey, thank you. I'm excited to talk about that. I
Oh,
am passionate about, like what we stand for. And medical freedom is huge because in traditional, so a little bit about me, okay, in my background, I did grow up in Connecticut, on the shoreline area. I did a lot of things in my life. I guess people I've talked to seem to say you're a serial entrepreneur, right? I'm like, yeah, I guess that, you can call me that, yeah.
right.
And one of the things that I did in my life, though, outside of entrepreneurship, was working as a dietitian, registered dietitian, and I
Mm,
worked mostly long-term care, but a lot of other areas that I was working in. And one of the things that I found actually during my rotations was that our medical system was broken. That you might have
so
insurance,
sad.
maybe they call it insurance, right? But when you
Right.
need it the most, I've heard story after story after story where maybe they're not there for you. I
Yes,
talked to one person with,
I can vouch for that, definitely.
really,
Yes,
I
very
love,
much so.
I will have to hear your story.
Denying my x-rays.
There are so many people. I've had people. One person told me in the middle of like a whole cancer treatment, she was sick, cancer.
Mm.
They decided no longer. Like she was almost in
Oh,
tears.
oh
Like
my
they were
gosh.
just not going to help her anymore. I don't know what the grounds are. I just saw something, like with this whistleblower that said she denied and delayed claims, all the time, and that denial, I'll share that with you, caused this particular person his life, someone she
Oh
knew
no.
about, but that probably happens all the time.
Yeah.
So,
Yeah.
when and so when I call impact medical freedom, it truly is. So like this is they've been around now for 5 years. So I will share with you a little bit about impact, about sharing in and of itself. Health sharing has been around for decades. You had to be a member of a religious community,
Mm.
and then if you went a certain amount of time, or there were certain stipulations that you go to the doctor, pay up front. Most sharing companies they are paying up front, and then they go back to the members, and then everybody kind of reaches in their pocket and helps them share in that medical bill, and they do it for you.
Mm.
So we have our CEO, his name is Phil Chrysler, and he actually decided that this is a great concept, but one, everyone should have access. So he changed the rules up a little bit, right? And he said it's not going to be religious based, it's going to be ethics based. That means anybody, any religious background, anything, but it's still based on love thy neighbor approach. So
Right.
because it's come out of religious communities, we still want to help everybody, right?
Right.
That
Because I'm not, Christian.
right.
So,
Yeah.
and they had no problems, in my application process to accept it.
Yes, right. So that is what we're doing. And it is very comprehensive with us. With us, you can go to any doctor you want anywhere in the country. Impact will pay for the doctor that you choose. Now,
Right.
let's say like the worst case scenario, you go to a doctor and they're like, gosh, we never heard of health sharing before. Well, we have a card, our Impact Health Sharing card, and it looks and feels exactly like an insurance card. We
Right.
even,
That's true. We
yeah,
just got ours.
yay, awesome. There's also, if you look on the back, something called that EDI Payer ID, which is
Right.
in all the clearinghouses. That's what allows traditional insurance companies to submit electronically. And
Okay.
whether people know it or not, every single insurance company is going to negotiate a different rate with the doctors.
Right.
So we're no different. We do it too,
Yeah.
but we are paying the doctors within 16 days after they submit, which is
Right.
unlike traditional, and they're getting paid about 2% more or more above the Medicare rates. So the doctors are getting paid more and they're getting paid quickly.
Mm.
That's something that if they take a look at what we're doing, that we can share with them. And then usually they have no problem and they're like, yeah, you are the exception. Impact has been the exception nationwide, as opposed to other health sharing companies out there. So it's awesome. We're also saving people 30 to 70% in their healthcare costs, as you saw, right off the bat. So when
Right.
you have savings like that, imagine, like, I also quoted a family of seven under $500 a month for a family with a $2,500 deductible. They
Mhm.
were saving like $2,000 a month.
Wow. That's
So
really impressive.
right? And so what I shared now, it took me, I'm going to tell you honestly, it took me a while to get out of the mindset of traditional insurance and look at this a few times and kind of, go through it with a fine tooth comb and be like, I don't understand. Like, what do you mean? How does this work? What is the $2,500 like a deductible? What does that mean, a sharing amount? So, there's a lot that I would love to share anytime that I have an opportunity to speak on it, or educate somebody. I really want to do that because it really is helping people get the care that they need right away. So if somebody needs like those x-rays that you needed,
Mhm.
they're not gonna haggle with that. They're gonna be like, the doctor says you need it, so you need it, so we're gonna help you get it. Right? And we're not gonna make you wait. And you don't even have to go get like a referral from a doctor or anything. You need it, you go.
Right.
So that's awesome. We also have a dental vision portion that we have. It's a discount program, and we've implemented that. And another thing that we implemented too is well care. So if you take steps to do things that are good for you, like let's say you see a naturopath, the sharing doesn't cover it, but we have this health and wholeness where if you go to a naturopath and they're providing asking you to take vitamin supplements, right? If you go to a gym, if you own a Peloton like I do, if you see a direct primary care doctor like I do, right? You can take those receipts and you can submit that. Just upload the receipts real quick on the portal, and they'll deduct up to $150 a month off your deductible.
Which is amazing.
That's a
That's
lot. That's like
that's what
18.
I love about it too, you know?
Right. And it saves everybody because if you're doing things to take care of yourself, then it's helping everyone. If you stay healthy, you don't need a doctor, right?
Right.
And we
Right.
can help businesses do the same thing. If they're employed, we have telehealth that's included. Let's say someone gets sick on the job. They don't have to go to the doctor. They don't have to just go on telehealth, figure out what's wrong, find out what their next step is. Things like colds, minors, flu, you can call teledoc. You don't have to go to the doctor. You don't have to be in a room full of sick people and wait all day because going to the doctor today is an all day affair, right? Isn't it?
Yeah, it is. It is.
Yep.
And
And
sometimes it could be like a big drive, a long waiting time. And then when you see the doctor, it's like 2 minutes or something, you know?
right,
I
right.
mean, I have to tell you, as you know, you told me about this, I think it was last summer, maybe,
Yeah,
or even before then.
yeah,
And it took me like a really long time to wean myself off of health insurance. And even when I was in the process of applying,
yeah.
it was a little scary to make the jump, because you've been so conditioned in our society that health insurance is what you need.
Mhm.
And without it, forget it.
Yeah.
Um, the other thing I was mentioning too, as you were telling me about all that stories, of how they denied coverage for that cancer patient and all that.
Hmm.
Um, when I think it was Blue Cross Blue Shield Aetna, where the CEO was talking about, no, it was Aetna, that's right. The CEO was saying how they will no longer cover anesthesia for surgeries depending on the time limit. I mean, things happen in the real world, you know?
Oh
I
yeah.
mean, that was just, I'm glad that the public pressured so much that she ended up reversing that decision. But
Thank
it
God.
just shows how out of touch, or I don't even know if it's out of touch, if they're maybe they do it on purpose, but it's sort of like a way for them to really not care, about people,
Right. Yeah. They're
you know.
occasional insurance is, it's profits. It's there
Yeah,
for profits. Right. They're not for people.
that's right.
Sharing is for the people, you know.
Right.
And yeah, everybody contributes a little. They have that premium, right? We don't have copays, right? We have limits, right? So I'll share with you my screen. I'll share with you a little bit.
Yeah.
Still, I mean,
Okay.
it's just still here meant to be overview. Probably is not going to get a full understanding, but I can
Yeah.
share at least a little bit, on here with you.
Sure.
But I will tell you
I'm going
that
to keep quiet from now on, so I'll give you the
no,
floor. So go
no,
go right
no,
ahead.
Well, I'm glad. Thank you for no, I want to hear what you have to say. Honestly, your story is going to resonate with so many people.
Thank you.
Truly.
Well,
5 years of impact. So announcements. I had some announcements I wrote down. More than 17,000 lives in our decentralized, not-for-profit, transparent company have been affected positively, right? And 25 million bills have been processed, and counting, have
mm,
been paid,
wow,
and none have gone unpaid.
amazing.
Isn't that amazing for a 5-year-old
Yeah,
company?
yeah.
Yeah. So let's see.
How
Yep.
many members does the group have overall nationally?
I think we're either just crossed it or really close to 16,000.
Oh, okay. So it's just kind of getting out there.
Yeah.
Because not,
So
I'll be honest, not many people know,
I know.
what this is, what this type of, I mean, you kind of heard, I heard here and there little bits, but it was never fully explained, and I never really took the time to research it either. So, if I hadn't met you, I probably would still be paying that heavy premium costs every single month. And even worse, the deductible
Oh my God.
too.
Oh my God. I know. I think about ours as like potluck. Everybody goes in and right. Everybody, if you don't know who's coming to your party, but everybody brings a dish, there's enough for everybody, right?
That's so true. That's a great way of looking at
Yeah.
it.
So now if there's enough, right, and we're not for profit. So if at the end of the year, if we have money left over, they give it back to the members. Every
Okay.
member has their own account. If somebody decided they didn't want to be part of it anymore, I think there's like after like 60 days, just in case some was, a little bit was for a member that was ill, taken, they will give you the rest back.
Wow.
So it's seriously your account. So
Okay.
I'll share, let me see if I can share my screen. Can I share my screen? Okay.
Okay.
All right. So like this is my website, right? So you can get a quote here. You can request information from the company or you can enroll right from this website. But if we talk about getting a quote, we can put in like a hypothetical birthday. We go by age, not income. So I could, let's say we're coming on February. So let's say this person was born February 1st, 1989, for example. Let's say one person is what we're getting a quote for. You can see that what pops up is something called the primary responsibility amount, and that's like your deductible in traditional insurance terms. And then here is be your standard rate. So anywhere from 102 to 246. So, so that's an idea of like what the premiums would be compared to, traditional insurance for somebody that age. But let's say this person is 3 or more people, and it doesn't matter how many more, the price won't change. So that same say, and this is, by the way, this is a household deductible. It's not per person in the household. It's for the whole house. So this family would pay 576 with a family deductible of $2,500 to put it in terminology that people are, familiar with, right? Traditional terms. Um, and then another thing that I wanted to share, let me know if my screen changed. Did you see it?
Yes.
Okay. So if I log in to my account, which I'll share with you,
Ooh. Okay.
let's see if I can. Sharing. It says it's failed, but it didn't really. So if I go to my dashboard,
Yeah, we could see everything on this side.
I know, community, and I go to the community. And you can see here that it's very transparent. Our company is very transparent. So you can see the total monthly shares collected here is 31 mil. And here's what our balance is. So this is nationwide. So here, when I started with and you could break down all to administrative fees and all of that. It's very transparent how much money that we actually have for members. Here's the membership summary. Now here are the active members across the country. So I said we were almost at 16,000. We're over 16,000. Now we're approaching 17,000. We're growing double digits. When I first started with the company 2 years ago, that number was 4,000.
Mm. Wow.
Yep. And so here are the largest needs shared last month. You could be anonymous. Usually they just do a last name of the household. And they do that because people want to know where their money is going, right? If we just said, oh, we're using it with these families, well, how do we really know? So they do this. And you can be an anonymous here as well. And then also down here, right, our bills are being processed, billing stats for the last 12 months, days to process and days to share. That's 16 days. That's what I mean when I say doctors are getting paid quickly. And
Yeah.
then our bills pending, the charges, prior to the repricing, right? Because they negotiate the bills for us. That's in the process right now. So that's great. And like I said, dental vision, you have telehealth, right? You can find a doctor through MD Live right here. We have lab discounts. So we would just, put in a get started. You want to pick your state.
Oh, so they do therapy count? Like you can, if you want to see a
Yeah.
therapist, let's say, or a
Yep.
psychiatrist, they will, allow that for that too. That's really important because I know a lot of people that do use, like, for example, grief counseling, marriage counseling, or just, you know, for depression, anything, and the insurance will not cover that.
Right. Yeah. No, this helps. This helps. Also, we have chiropractic physical therapies up to 50 visits.
Oh,
You
wow. Okay.
so yeah, so if I wanted a quick medical visit, just, throw in what ails you, hit next, and a list of doctors come up. So, we have a lot to offer, when it comes to impact health sharing and really putting the healthcare in the people's hands, in our hands. What's good for us? We've had people get organ transplants or cancer treatments anywhere they want to go. They've got, Cleveland Clinic or Mayo Clinic, and everything stays the same. That same deductible, that same. I also, if you think of like car insurance, we all have car insurance, right?
Yeah.
But we pay for our own tires, our rotations, if the car needs a radiator, if we need windshield wipers, like any of those things, we pay for that, right? But if something major happens, we have the insurance, right? That will help.
Yeah.
So it's almost the same as here, where we have, we might we go to the doctor, we're still going to have a negotiated price. So no one's giving us negotiated price on windshield wiper or any of those other things. Here we're doing the negotiated price. But let's say something major happens, right? There's a maximum out of pocket. So you could budget your health care. So like, for example, we had a guy, he was on that $2,500 deductible sharing amount. So I believe it was almost $500,000 the bill came out to. His responsibility was 7,500. Now,
Wow.
when you're saving someone like that family $2,000 a month, right?
Right. Of
And
course.
you're paying so much less, you might think like, oh, 7,500, that, that's still a lot. Well, if you had traditional, it's gonna be a lot more. But
Mm,
if you had, with us, it's that, but we're also saving you so much money every single month on that premium
right.
that you just put it
Oh,
away and you have that
um,
max in the pocket.
this was something that I was concerned about because when I was signing up, or even trying to even think, okay, should I jump and bail on the insurance? My big thing, as I had talked to you about, was can I keep my own doctors?
Mhm.
Because obviously I've had a relationship built throughout the years. They know me, they know my health history, everything. And you had said yes. And when I typed in the zip code that I live in and wanted to see who would be, available, I did not see that doctor's name.
Mhm.
And so that kind of concerned me. So calling the 855 number, the main number,
Yeah.
they did tell me that it's just talk to the billing office, let them know that this is just like an insurance card. They'll plug it in and they'll be paid in 16 days and nothing will change. You can go to all of your same doctors, all your same pharmacies, nothing will change, which that was a big relief.
Yeah, right. Exactly. So they are there for us. Impact is a community of people and for us. They're
Mhm.
not working for a profit. They're working to get the care that people need. And whatever
Now,
they have to do to help us do that, they're going to do.
and what about pre-existing conditions? Because that
Yep.
was another concern too that I had.
Yes, exactly. Right. So when it talks about pre-existing conditions, we do not turn anybody away on those. Nope, we do not. We will still negotiate their bills. However, There's a couple, like if you have that type 1 diabetic, right?
Mhm.
That is a pre-existing. That's something that's never ever going away. And so when there's something related to that, we can't help them with that. So they can keep Impact as a secondary and pay less with their traditional insurance. They can still do that. And I forgot what the other one was right now. But there's two different things. Now, when it comes to high blood pressure or high cholesterol, those are things that can be managed. So as they're managed, that's not considered pre-existing for the purpose of any future cardiovascular event. Let's say somebody had cancer 5 years ago, but they want to start with Impact today. That would not be considered pre-existing because we look back just 36 months and their issue was 5 years ago. And that is on the condition that they don't have any medication, they're not being treated for anything, like it's gone, like it's been gone, right? No
Okay.
treatments, no signs, symptoms, any of that. So that's not considered pre-existing. So that's how pre-existing works.
What about, for example, if you have, let's say, multiple sclerosis, or, you know,
Mhm.
I'm trying to think something else that can be managed. Arthritis. You
Yeah.
can manage all of the asthma. That's another one
Oh
where you
yeah.
can manage through medication and prescriptions.
Yeah.
Um, but
Yeah.
it's not like you're going to, and you're stable. Um, would they be considered having a pre-existing condition?
Right. So it probably would be, but it's definitely beyond my scope. That's why we have the impact
Right.
here, right? Everybody is
Right.
very individual. We've had people that are diabetic, type 1 as well, and this one person saving $500 a month on her medication, she got onto impact. She did keep, I think, a little as a secondary, but the amount that she was saving just on her medications alone made it completely worth it to get on here. It was saving her a lot of money. So, so we take those pre-existings kind of on a case by case basis, and then we let them talk to impact so they can really figure out like what is best for them, and then do that comparison with what they've got now, and how this might be a benefit, or maybe it's not for them. Like it's definitely not for every person. I think like over 70-80% of the population are relatively healthy, and
Mhm.
that's we're going. That's pretty much who we look for.
Okay.
Yeah.
Well, that's good to know too, so
They're
that
paying
people.
more than they have to, right? For
Right.
insurance. Yeah.
Right. Well, I suppose once the program gets bigger and bigger with more clients and patients getting involved,
Yeah.
it might be a different scenario.
Oh yeah, they're giving back.
Probably then
But
be able to expand.
yeah, yeah, because we didn't always have the dental vision. And this is like I said, just in 5 years.
Right.
We didn't have the holistic credit, where you can see a naturopath and submit, they're getting like every member is getting like, or every family household is getting up to $1,800 a month, right? If they're doing things that are healthy. That's a lot.
Well, let's talk about the dental and the vision, because that's something that a lot of people use, obviously, too.
Yeah. Right.
So how does that work?
So dental vision, we have a partner, Carrington Partnership, and you just look. It's free, actually. It's no extra cost to the members that are already members, right? And even if you sign up today, that's not what I mean. Like starting up today, there's a cost. There is no cost to any member, and so we partner up with this company, and then you just look up your provider. If they're not there, you can actually what do they call that? You could not sponsor them, submit for them to be part of it, right? And qualify that. I don't know, whatever. I'm looking for the name. I can't figure out the name of it. They have something. You could submit their name and they could be member.
Oh,
And
okay.
if they're not, or if you're looking for a dentist or an eye doctor, like I went to my eye doctor and I was like, I just got this, and I don't know if you guys participate. And they looked at it and they're like, oh yeah, we do. So I didn't have to change anything. Like they already do. So they just took that. But if
Yeah.
you don't have one and you're looking for one, you can look up who the current providers are and just go to there. And we're
Yeah.
saving a lot of money.
That's true. And it's a very, very good company, I should say, Carrington, because I myself used to have a lot of patients that had it, and they were great in payment. I would get it very quickly. And, they were I had no problems in even talking to any of their
Wow.
representatives
That's
either.
really good because we just got that recently and
Really?
you're in the
Oh,
business,
wow.
so it's good
Okay.
to know.
So
Yeah,
they're
right?
very reputable, that's for
Yeah.
sure.
Oh,
At
that's
least
good.
from when I was dealing with them. So I'm pretty sure they're probably the same.
Yeah. I think so. Yeah, I think so. Like I gave my card. I haven't heard anything since. I mean, everything is just fine, you know?
Okay.
Yeah. They knew, they submitted, they were great. Yeah. Yeah. So,
Well, anything else that you want to, you know, talk
um,
about in terms of this?
let's see. I think, yeah, the only thing that I could
Oh,
say,
vision
vision.
too.
Oh, it's, yeah, dental.
In terms of glasses, eye exams, all of those contacts,
Mhm.
would they be also through Carrington?
Yeah. Yeah.
Okay.
Discount program. It's a discount program. Yeah. Yeah.
Okay. Okay.
I
Well,
would
that's
I would just say that anybody that's looking to save, right, relatively healthy, whether you're individual, a business,
mhm.
anybody that has to pay their own healthcare. When I had my
Yes.
very first business, when I owned my first auto body shop, I was like, oh my God, healthcare. I had no idea how much it was. Like I was 22. So one, we're just getting off of our parents pretty much, right? Starting a business, we needed our own. I'm like, oh my God, my employers paid what? Like, huh? Like this is
Yeah.
expensive. This is one of the biggest expenses that we have. So being able to help people save, help people with their, medical costs, help people know that there's a cap,
Mhm.
that they could actually almost budget for their healthcare is something that's great. If you've heard of sharing before, um, look at this one. It's different. It's different than other health sharing companies out there. So, you might have to wrap your head around it a few times, listen to the information a few times. We have an informational session every Tuesday at noon that's on Zoom, and they have question and answer there too. So, if anybody wants to contact me and they want to know more, they can certainly do that. My phone number, just call me or text me, is 860-916-3676. And I'm happy to talk to anybody about it. If it's for you, wonderful. If there's something that gets in the way, it is something pre-existing that won't work, that's okay, but at least you are knowledgeable of what else is out there.
Right. So what is the website again? So if anyone did want to know more and attend one of the Zoom meetings.
Yeah, I would just call me and then
Okay.
I'll put you into, I'll either send you my web link or it's better if I share, personally the link to the Zoom.
Oh, okay, okay.
'Cause
And
I
then
can't
if they
have like
just wanted
everybody
to know,
flown in there, right? I gotta like invite
of
them in.
course,
So, yeah.
sure, sure. And then also when it came to just getting general questions answered, what is the website that they should go to?
Yeah. So mine, I don't have listed. They just call me. I will send them that website.
Okay, okay.
Person to
All right.
me.
So I'll
Not a
just make
picture
sure
on
that
there.
your number
I
is on.
represent the company, so it's me. Call me, and I will
Okay.
definitely get you in touch. Yeah,
Okay, so
yeah,
that's what I'll do. I'll just put your number out, so
yeah.
that way they can get in touch with you and ask.
Absolutely.
Well, thank you very, very much. This has been really informative. I'm so glad I had you on finally to
I
talk
know. That's
about this.
yeah,
And yes, like you said, it may not be for everyone, but if there are some that are willing to kind of let go of the insurance companies and, they want to try something new and something that would still be able to give them that affordability and coverage,
yeah.
I think this is definitely a great alternative.
It is. Oh yeah, and we do the 65 plus too, so we can help Medicare as long as they're on Medicare A and B. We can help them.
Okay.
Whatever Medicare doesn't cover, would cover 100%. So we can explain that too.
Well, thanks a lot then, Maria.
Yeah.
So hopefully it will create a little bit of a buzz and then you'll get some calls.
All right. Sounds great. Thank you
All
so much.
right.
All
All
right.
right. I'll be in touch.
Okay. Have a great day.
Okay. You too.